Hi, I'm Dr. Pajari for the Prognosis podcast, and today's episode is The Power of Prognosis. Dying is not easy to recognize. It takes experience and skill to understand what dying looks like in order to then offer guidance to those who are in the midst of the process of decline. And though we look to our faith systems to guide us, often they focus more on celebrating life than discussing death. Returning back to the reason for this podcast, to emphasize the importance of receiving an accurate, comprehensive, and timely prognosis, this episode centers around why prognosis matters. This episode centers on why understanding what is going on when a loved one or yourself is irreversibly declining is critical to preparation and gaining closure. My guest today is Kim Green. She is a medical derm representative for Sun Pharmaceuticals, and I'm super happy to have her here today. Welcome.
Thank you.
Kim, we're going to just jump right in. We've talked a lot so far. Mm-hmm. Tell me, this is really a story that it needs to be told. So starting from the beginning of the story, this revolves around your family, your mom. Mm-hmm. But tell us a little bit about your mom, who she was as a person, just to give the background of the story. And there's probably a lot to say.
I think there's the mom that I remember as a little girl, and the mom I remember sort of as an adult, and then who she kind of became. So there's all those feelings about who she is, and but predominantly I think that she was really the most significant person in my life to a great degree.
Mm-hmm. Tell us about her character, who she was. You know, you're saying she's the most significant person. Why? What connection did you have to her?
Well, I was the last born.
Mm-hmm.
I'm a twin, but I think that she was very, very strong, very, very committed to being a mom, but in a way in which my dad would joke and say that when people asked him what she did for a living, he said that she ran Green Corporation. And so she was definitely a very regimented, very organized, list-making person. And I can't say I wished that I could be as that way. To the end, she was still trying to write lists. Mm. She was super determined and very outgoing.
Mm-hmm. Who was your mom in terms of, tell me a little bit also, I was going to say, about your family. So your mother sounds like a formidable force in your family, mm-hmm. running the family.
Yeah.
The matriarch of the family.
Mm-hmm, definitely.
And then she had a lot of kids.
Yeah.
So tell me a little bit about your family, the family that she was running.
So there is myself, my twin, my brother, who's almost 4 years older than me, and then a sister who's 13 years older. Mm-hmm. So it was almost like two different families in some regard. And that was due to the loss of my oldest sister, who I never was able to meet. She had passed well before I was even really what I say a twinkle in terms of being on earth, really. Mm-hmm. And so she passed away from a tragic accident.
How did your family or your mom deal with that loss? Was it spoken about? Was it not spoken about? How did they deal?
It wasn't spoken about, and my mom's death had really heightened my interest in Heidi. Her name was Heidi Beth, and realizing that we didn't talk about her a lot, and there were so many questions that I wish that I would have asked my mom. And towards the end, she would have dreams about her siblings, and she even said that she was having dreams of Heidi. And all of those things were signals to me that she was preparing to pass away, but I had no idea.
Why do you think, Kim, that it was something that wasn't spoken about? That's a very deep question there, but why?
I can't say for certain, but I do think that there's a Yiddish word called shanda, and it's a shanda to talk about certain things. And I think death is one of the things I can't say all Jewish families, I can only be representative of mine, which follows the Reform Judaic principles and so forth. I don't think there is any kind of a law that says do not talk about death, but I think that it's almost like a sidebar conversation until it actually happens.
Did you feel like that was contributing, that the faith aspect or the maybe kind of the background is what was preventing? Sometimes it can be a personality that doesn't want to deal with talking about things. Sometimes it can be more, as you said. I think there are a lot of cultural legacies where, I mean, let's face it, overall death is not embraced or discussed. So that's not an amazing revelation per se, but sometimes tapping into what might be driving that on an individual level helps too. Do you think there was a personality aspect or more from, as you said, maybe Shonda, or this perception that we just don't talk about these things?
I think it was a combination of things. I think my mother had a tremendous amount of pride. I almost think that there was shame around her decline. So in talking about death, that would be accepting the decline. And I think she fought tooth and nail. She wanted to still be seen as that super energetic, outgoing, someone who could command a room sort of person. Almost close till the very end when I saw a really significant change in her personality, and it was really quite unusual. And it's sort of like I was dealing with a different person.
Well, so let's talk then about, it sounds like your mom probably, we were talking about the loss in your family and an inability then at that time to even acknowledge that loss and talk about it. And probably that had a significant impact on your family. And then moving on to more recently where you witnessed your mother's decline. Tell me about that story. Tell me about going back to the beginnings of it and then bringing us forward to, the most recent events. But tell me about your mother's decline as you see it now, how it unfolded.
So I think I began to notice her memory issues, and she, for as long as I can remember, she had such an incredible memory, as do I. And I would say there were sometimes things that I wish that I could forget. I wish she would forget. Although there's very significant things which she did, which I can share with you, which is kind of interesting. But it really was the memory loss and the not knowing people's names and starting to refer to everybody as what's her name and what's his name. And I would say to her, I would say, Mom, you know what, there's no shame in saying forgive me. You know what, I recognize your pretty face, but your name isn't, it's on the tip of my tongue. Mm-hmm. But she would never admit that she
couldn't remember.
Yeah, the names. And then she was living independently, and she had a very close friend that was down the hall. And she alerted me to the fact that my mom was coming down the hall and asking for assistance with different things, buttoning something, zipping something. She had difficulty lifting her arms after years of getting cortisone shots. She was bone on bone in her shoulders, so she couldn't lift her arms really past here, almost like a bird that couldn't fly. But I think that when she started really kind of acting different. Her personality sort of was changing, and she was crying a lot. And I definitely saw signs of depression, and talked with her primary care doctor about it. She was on an antidepressant. And from the first time when she first moved to Atlanta, I brought her here because I started to see the decline with her macular degeneration. I knew it wasn't safe for her to drive a car, and I wanted her to be closer so I could look after her. But she was very adamant about living independently, and I was lucky enough to find the Jewish Tower, which is on the complex where the William Bremen Jewish home is. And quite a few people will make the transition from the independent living to the home. And that's what I kind of thought would happen. But you were asking more about noticing the decline. So, her mobility was declining, her ability to stand for long periods of time, her having complaints. She never complained about anything. And again, I think that's part personality and part how she was raised. That you don't speak about things that are bothering you, that almost sickness was almost something to kind of be ashamed of. So I don't think that my faith teaches that. I think it embraces and understands that people will get sick, and there are certain prayers that are pointed just towards that. But I think that's more of her family dynamic. It was kind of like I guess the Southern expression would be, the toughen up buttercup kind of way you look at life. And she was pretty strong, pretty tough lady.
Yeah, it may be also a generational thing too.
Yeah.
When you were speaking, I thought of my own family members and things where, there's an aversion to talking about I'm sick or I'm not doing well or I can't do this. There's a strong will to be independent, not dependent. So, there are a lot of aspects to it, personality. And then, as you said, maybe not an ability to kind of discuss things culturally in a way where people are used to it, getting used to the idea of discussing mortality or dying. Tell me more about her decline. So you started seeing these elements that were coming up. You started to think, okay, well, she's declining. And then it started to accelerate, it sounds like.
Yeah.
So tell me about the acceleration portion of it.
It was probably about 2 months before the pandemic, and she started saying things that she had never said before, like about how she didn't want to be here and that she would be better off dead. And it was very frightening for me to hear her saying those things. And I began to feel worried about leaving her. And at this time now, I had some helpers. Somebody would come in the morning and kind of get her up and about, get her compression socks on and give her breakfast and help her with lunch. But I also noticed that she wasn't eating as much. She was losing weight. And she actually, there was a part of her that sort of was pleased about that. She was always somebody that prided herself on her opinion, or not her opinion, but her appearance. But my twin sister and I, and also my sister last night, we were just talking about how my mom always thought she was like the bomb diggity. Like she always thought she looked fantastic. And I remember my father calling us, girls, come see how beautiful your mother looks. And so, this emphasis on, presenting yourself as being healthy and beautiful and
well put together.
Yeah. And I started to notice she wasn't taking as much interest in her clothing. Certainly her eyesight was affected and she was having, more trouble. And I took her to the eye doctor and they basically said that there's nothing that we can do. I mean, the macular degeneration had advanced to a point where whatever medication that she was getting from the ophthalmic specialist that focuses on macular degeneration, she was kind of at the maxed out dose. So all of these things were signs and part of the
And
her,
kind of
her
all
decline.
at the same time, or kind
Yeah.
of accumulating. Yeah.
And so I guess I always kind of looked at it like we were in the maintenance phase of life. And by no means did I think that she was going to pass when she did. But what had happened at that 2-month mark, I engaged with a psychiatrist. And she had a couple of visits. And the very first psychiatrist was a nurse practitioner. And I spoke with her afterwards, and she was very concerned about my mother's mental state and asked me how I would feel if my mother did some inpatient hospitalization to help treat the depression and try to sort of tweak out what part of this is depression, what part of this is aging, or maybe this is part of something else going on with her. She was pretty adamant that that's not what she wanted. But then when she started getting into this idea of maybe I shouldn't be here, maybe I should be dead, I was very frightened to leave her alone. I couldn't be with her 24/7. So I engaged with another psychiatrist and hoping that she might just change the medication. I think she made one medication change and there wasn't much change in my mother's behavior. In fact, it almost seemed like it was getting worse. And so that psychiatrist wanted to admit her. And we spent an entire day. One of her friends from the Jewish Tower came to my house, and my mom was over at the house, and we had a meeting with the psychiatrist, and the psychiatrist was going to explain that at her advanced age, given the way she's feeling, that we need to understand more what's going on with her mentally and physically and emotionally. And the only way that we can do that is to have eyes on her. And because of the pandemic, this psychiatrist was not seeing patients in person.
In the office.
So we did some research, and there are a couple of psychiatric hospitals in the area in Atlanta, and I identified Ridgeview as being an appropriate place because they have a whole wing that's just focused on geriatric depression. And so the idea was we need to get her checked out from, I guess, a vital standpoint, that she's stable on all of her other medications in regard to the underlying vascular disease and the diabetes, and she had a lot of comorbidities. And again, another signal that how long can somebody last with all those comorbidities, and what's that doing to the body itself, and how hard is the body actually working to maintain the person, the life that was my mom. But in any event, the circumstances occurred that I took her to Emory St. Joseph's, and I thought she'd be there for maybe 3 hours, and then I would take her. Well, I had already done the pre-admission. She now was at a place where she agreed to go to Ridgeview. She didn't want to live the way she was feeling anymore.
She was recognizing it still.
She would cry. Yes, I don't want to live like this, because that's what I would say. Mom, I want to help you feel better. You know, for whatever time that you have left, don't you want it to be doing pleasant things, for us to go on adventures and for you to be enjoying things? And once, things open up again, I would always talk about when things open, the lockdown for her was devastating. So it was that whole combination of then what happened at this hospital visit. She was diagnosed as COVID positive, asymptomatic, in the emergency room.
This was before getting clearance to be able to go to Ridgeview.
This was at the visit to the ER where she was going to get clearance to go to Ridgeview.
To be able to be admitted to Ridgeview.
And they checked her into the hospital. I said to the physician, it's not possible, because I actually had gotten her a COVID test 3 days before. And it wasn't the rapid test, it was the one where it takes 3 days. So that morning, she was COVID they called me to tell me she was asymptomatic. And so because I knew taking her to the hospital was going to be a risk.
Right.
And I wanted to make sure that they knew on her coming in that she was negative. And here they told me she was positive, which was very confusing. But there was almost nothing I could do. It was almost as if
the machinery was set in motion.
Yeah. And it was as if they just took her. And I remember that look on her face.
That must have been a pretty devastating
horrific.
moment. Yeah, because you knew she was going in and wasn't going to be able to see anyone.
Yeah.
Was not in the right state of mind and suddenly got sucked into a system.
Oh my gosh.
COVID positive with isolation and quarantine in a hospital.
And they let me come into the ER, and so far as checking her in, so keep in mind she hadn't been diagnosed COVID positive asymptomatic yet, but I remember seeing her face and then them closing the door of the emergency room, and honestly, I wasn't there was something not right. There was something not right in them not letting me be with her. I mean, she could barely see, she could barely hear. She was 94 years old, and I said to them, she needs a patient advocate, and they're like, well, we have patient advocates in the hospital. We'll get her a patient advocate. When I spoke to her on the phone, at that point, because of the dementia, I don't know if she could remember whether a patient advocate came or not, but there was no defining moment that I felt that there was. And so basically, she was stuck now in the hospital for 9 days. And it was incredibly traumatic for her. And I think this also brought up for her how Heidi went to the hospital and
Heidi,
never
your
came
sister
back.
Who had passed away.
And so she had mentioned that to me as to being one of the reasons why she didn't want to go to the hospital. And whenever she had to go to the hospital, she sort of fought me on it.
It was a traumatic memory going to the hospital.
I mean, I don't think anybody is excited about the idea of going to the hospital, but it was absolutely particularly traumatizing for her. And the idea that she would go to the hospital and they would help her there was, I think at this point now, she knew she couldn't live as depressed as she was, but by no means did we think they were going to check her in and keep her there.
Right. And also I wanted to
9
ask,
days.
did you feel that exacerbated, not just from a, kind of dredging up the trauma,
Yes.
but just isolation in a hospital with the demented, with the patient with dementia is particularly traumatizing.
Oh my God, absolutely.
Yeah.
And, I'd speak to her on the phone and she's like, get me out of here. And she's from Brooklyn, so she didn't mince words. And so she was emphatic about getting out of there. And I don't know why I'm here. And I had shared with them, the hospitalist, why she even had come to the hospital. So now they pulled in psych. And also her kidneys were already, I'm trying to come up with the word, but there was already kidney failure going on.
Kidney damage,
but yet they brought in a nephrologist. It's like, I almost felt like they were trying to make her visit more purposeful at the hospital, but also what they were doing, I think, is the guidelines were she had to test again 5 days later. I mean, I don't know who came up with 5 days. And then 3 days after that, before they'd even let her out of the hospital.
In total, how much was that time spent in the hospital then?
Well, it was total 9 days.
9 days. Yeah.
And it's like, and intermittently, I was talking to the charge nurse. I was trying to talk to the medical director of the hospital. I wanted to get her out of there. I knew that her being in the hospital was exacerbating the way she was feeling. And now I recognize it was accelerating her demise. And when I finally picked her up, she was incredibly angry. And she also was in such a horrible mental state. She thought they did surgery on her. And she was like, they took my kidneys and I have a scar. She had had a previous operation on her intestine. And I think what she was touching and feeling was an old scar. She absolutely was convinced that they operated on her.
It's interesting. She went in almost, not in a great state of mind, but she comes out and then she sounds like she's irrational in her statements at that point.
Yeah.
And that they released someone in that state, irrational, but it was still the better thing to do, obviously, than holding on to her. What a confusing.
Well, and also what happened was by psych visiting her so many times in the hospital, she used up her psychiatric benefit. And so now I had to petition Medicare to try to get her to Ridgeview,
where she originally was intended to go.
Yeah. And they turned it down twice. And so now where she was living, the Jewish Tower said she can't live here anymore because now they considered her a danger to herself. So now I had to pivot and find an assisted living facility. So now she was, in what I guess can be referred to as kind of a delirium state. And so I reached out to Jewish Family and Career Services, which is an organization that doesn't just focus on the Jewish community. It does outreach in every community, the Indian community, the Black community, all communities. But obviously was started by people that are Jewish. And they have a geriatric division which has clinical social workers and so forth. And there was a woman that I had reached out to before, anticipating that my mom would need assisted living. And quite frankly, she probably should have been in assisted living sooner. But she really fought about wanting to go into a place. And then what happened, within 2 or 3 days, she seemed to kind of come out of that acute state. And she was wanting to spend time with one of the ladies that helped her during the day. And she talked her into taking her to the mall, which she knows was a no-no in my book because it's still the pandemic. She wasn't vaccinated. They were still just talking about the vaccinations. And I didn't want her to do any shopping. I would say to her that we can shop on Amazon. But I guess this caregiver gave in to her. She must have really been very emphatic. And she wound up falling in the mall. And the paramedics came to the mall, and she faked that she was okay. And so that's when I finally realized that she was going to have to go into assisted living, because a day after that, she woke up and she couldn't even walk. Now she had to go back into the hospital and then into rehab. And I think that was really the beginning of the end.
Did she fracture? What happened?
No, she didn't break anything. But sort of going back just a moment to the hospital visit where she came out so delirious, I had spoken to the charge nurse and I said, I would appreciate if you talked to the hospitalist and we got a recommendation for her to do some rehab because she was in a bed for 9 days. And they didn't suggest that she needed it because she wasn't in the hospital for any kind of an injury. So I think that was overlooked. I mean, there's just so many things now looking back that it's almost mind-boggling how complicated the whole process is. But what now is really so evident to me is she was in the dying process. And I'm not saying that everybody that's dying goes through a depressive state, but this is